This is kind of a good lead-in for the next set of talks. And so the morning sessions had, obviously a theme, which you could argue were on the red side politically, although this really shouldn't be about politics. This should be about the best way to deliver healthcare. But now we're going to talk about something that's associated with the blue side, although the people that are speaking aren't necessarily on the blue side, but it's the topic of, should we have something universal? Should we have some sort of safety net? That was maybe the intention of the Affordable Care Act. What was good about that? What was good about the ACA? What was bad? We just talked about a universal HSA. That could provide a certain universality. And there's a person here, David Riemer, who's going to speak first. And he was advisor a while back for Senator Ted Kennedy on healthcare policy. He's written a great book as well, Putting Government in Its Place, the New Deal 3.0. I hope I got the title right. I'm working off of memory, David. But David is a policy expert that worked with Representative Kurt Gielow, who was going to be here, but he had surgery yesterday, so I hope he's okay. And we have a video from Kurt. And Representative John Richard, who is a Democrat, Kurt is a Republican. They drafted legislation years ago that was going to provide universal health care for Wisconsin, and it failed. But David is going to talk a little bit about, in a more general sense, universal health care, some ideas that he has to set the stage because he's a policy expert. Then we'll hear from Kurt, then we'll hear from Representative Richards about their plan for universal health care, what was good about it, and why it didn't succeed, and maybe how we could reapproach that same problem. So David, thanks so much again for being here. Did a great podcast with you as well. So if you want to share with us some of your views, if you want to touch a little bit on your idea for young Medicare, and then kind of lead into what you did with Kurt and John.
Glad to do so. I'm hearing a little background noise from someone on the call.
Is there a way to get rid of the background? Someone's not muted.
Okay.
So she says, where's the herring?
I'm
trying to fix it on our end, but
radio or something.
Whoever is not muted, mute yourself. We'll try to fix it.
I took the herring,
Okay.
and I took the bone out.
Oh, I know what that is.
And I split it in
Sorry.
two.
Oh,
That's
you did.
That's my grandmother. I brought on. Okay, good.
Grandmother, it's okay.
Sorry. What I wanted to do was to talk about a program called Young Medicare that I've proposed as part of my book that you correctly gave the title for. And Young Medicare is heavily influenced by the work of Alan Enthoven, Stanford University emeritus economist. It's influenced as much, however, by the experience we've had in Wisconsin with the state employee health plan as it's operated in Dane County. And it was also influenced by the work that I did with former Representative Kurt Gielow, former Representative John Richards on the Wisconsin health plan, and later a variation of that called Healthy Wisconsin. So I'm going to try to quickly, in just a few minutes, run through the main policies that underpinned the Young Medicare proposal. I'll probably skip over some detail and maybe get back to that during the Q&A. So the first principle of the policy is to provide everybody, or virtually everybody, under age 65 with health insurance. So it basically covers everybody in that category, except for people who are not legally present in the United States, people who are in prison or institutions, people who are covered by some other plan. So some people under 65 are covered by Medicare because of a disability, and others prefer to get their coverage through the VA system or the military system and so forth. But virtually everybody under 65, the overwhelming majority, would be covered by this approach. The second thing that it does is it guarantees everybody excellent benefits. Competition on benefit amount, I think, is not terribly helpful. It's a major source of confusion when you're looking at choices and they have different deductibles and copay, and this benefit is slightly different. So Young Medicare would say, look, let's give everybody make sure everybody has medical care, hospital care, prescription drug coverage, all the essential health benefits that are spelled out in the ACA. And it also proposes having no deductibles and no co-insurance and co-pays that are very limited to the situation where you choose a brand name drug when a generic drug is perfectly acceptable. There's some benefit to having cost sharing, but the major impact is it produces more negative outcomes than positive outcomes. It discourages people from getting necessary care when they face a significant deductible or copay. Then when they go in, they're often sicker and sometimes they even die because they failed to get care up front. So this seeks to use price signals, cost, but not when it comes to the point of service. So the most important part of the plan that needs the greatest description is the way it uses individual choice among healthcare plans that are competing on price and quality. So what Young Medicare proposes is that every covered person, this vast group of people under age 65, would be assigned a health insurance purchasing account. The account would be for each person. So it wouldn't depend on your relationship with another family member. It wouldn't depend on your relationship with an employer. You would get it because you're a covered person. Parents would control the account for their children until those children turn age 18. And every year the account would be credited, would be filled with a dollar amount determined through a competitive process. Its value would be based on, would be equal the lowest premium bid in a county by a qualified healthcare plan to deliver the benefits that I described earlier. The amount would vary by county because different counties in the country have different levels of cost, different organizations of their system. And the dollar amount would be varied actuarially based along a standard actuarial curve where costs are higher for older people, lower for younger people, where costs are higher for women for a period before they become lower for women. So the plans basically would be invited to bid on this benefit package on a base price, but the actual payment that they get would depend upon the age and the sex of the person that actually chooses that plan. The plans would be free to bid on just one county, just to deliver their services in a single county, or any county in a state. They would define their bidding territory. Government wouldn't have any say in where they choose to bid. Then on an annual basis, individuals would pick whichever healthcare plan they want to enroll in. They could pick the least expensive plan or a more expensive plan. They could pick an HMO, a PPO, a fee-for-service plan. Whoever wants to bid on this benefit package would be free to do so. But the value of the account would equal the lowest amount bid for that particular age and sex. People would be free to join any plan, but they would have to pay out of pocket on an after-tax basis for the extra cost of the more costly plan. So you would have a normal market where people would have a wide variety of choices among competing plans. They could go with the lowest cost plan, the same way people can go with the lowest cost car or computer or telephone or anything. But if they wish to pay more for something they value more because of, in this case, the doctors in the plan, the network, the location of clinics, the location of hospitals, reputation, what they hear through the grapevine, what they get on Consumer Report or other objective independent systems, if they're willing to pay more for it, they could do so. So the bottom line here, just to sum up, you have, as a result of this, all Americans, virtually all Americans would be covered, either through Young Medicare or Medicare primarily, with smaller groups covered in some of the other ways I described earlier. There'd be an annual choice of plans on an individual basis. People would have a profound incentive to pick a lower cost plan. Why spend more unless you're getting something of greater value to you for the additional out-of-pocket cost? And that puts pressure on the healthcare plans and then the providers that work with them, either in a tightly knit organization like a staff model HMO, or it could be a fee-for-service model, that there would be enormous and enduring pressure on the health insurance plans and on the providers to both lower their costs and improve their quality, which is the way the market works for everything else.
Right.
The final point I'll make is, obviously this costs a lot of money, and some people who now pay more will save money, and others who are paying less will pay more. And we'll talk more about that. But all of the studies that I've seen that address this kind of model show that the total cost would be less, which would be a benefit for businesses if they're involved in paying any portion of it, and also for taxpayers as well. So let me stop there.
Great, thanks, David. That was great. And David, anybody who knows David Riemer, whether you're a Republican or a Democrat, knows that he's an impressive policy expert, and he goes into great detail and is well researched in his book. He's got a chapter in my book. Kurt, who's a Republican, and David is a Democrat. Kurt thinks very highly of David. David appreciates the value of market forces. So if we can, because your work with Kurt and Representative John Richards kind of led to this Wisconsin health plan. So Sean, can we play the video of Kurt Gielow?
The Wisconsin health plan was introduced by me and my colleague John Richards in 2005. And it was an attempt at the time, as we go back. Years now. At the time, the population of Wisconsin, about 5.5 million people, so it's grown 300,000 in those years. And about 9% of that population was uninsured, meaning they didn't have any kind of insurance. So we wrote a plan along with David Riemer. You're going to hear from both my colleagues a little bit later, I believe, and I'm sorry I can't be with you today, but you're going to hear from both my colleagues about an attempt to try to cover those not covered, that 9%, and also to address the structural deficit at the time that we had in the Medicaid, state Medicaid program, which of course the state still has. So the unfortunate thing is in 15 years, not much has changed. That's the bad news. This was an attempt at being purple in the sense that it was what my colleague John Richards wanted, which was universal coverage. It covered everybody. It covered everybody under 65 if they weren't covered by some other plan. And it was my attempt as a good Republican to try to put free enterprise opportunity into it by having private plans bid to provide the service, to have the individual citizen have the election of what kind of plan they wanted to buy, and to also provide them an annual HSA or health savings plan, or we called it forgot what we called it, a health insurance purchasing account, I believe we called it, that allowed them to use it as they wished to use it for incidentals and co-payments and things like that. Unfortunately, it didn't get we introduced the bill. It didn't get a hearing in either of the committees to which it was assigned. And by virtue of that, at the end of May, it failed as the session closed down, and it never got consideration. I think we did, both of us, catch the rancor of both sides. The Democrats thought it had too many Republican ideas in it. And my colleagues thought it was way too progressive for me, and I was castigated. I mean, I was criticized at the time. So we got the rancor, but we didn't get the result.
So what do you think? So it sounded purple in the sense that it had private markets and competition, but it also had the fact that it was universal coverage for everybody. What about it? You're a Republican. What about it from the Republican point of view made it so unpalatable? How come it didn't pass, and what would
well, it was, frankly, we introduced it to stimulate discussion.
Yeah.
What we got instead was a bill that was dead on arrival. It never got discussion. It never got introduced, and it never had the debate that ought to occur in a legislative body. Mm-hmm. So that's very unfortunate, and unfortunately, that atmosphere still exists today. 15 years later, there's still the rancor without the debate and not without the discussion. And that's unfortunate because we can disagree.
Mm-hmm.
So, but at least we ought to listen to each other and we ought to debate it. So our bill was put out there to be a stimulant to a discussion, but instead it got killed right away and there was no discussion. And John and I probably both suffered politically because of it, but it is what it is. I came to try to serve people, and I had a healthcare background, so I thought it was a reasonable attempt. It had things in it I didn't like.
Yeah.
It had things in it John didn't like. But isn't that what compromise is about? And isn't that a purple solution? A little bit of red, a little bit of blue, to get purple. And it's just unfortunate that we couldn't get it. But I think the Republicans particularly objected to the employers were going to pay a payroll tax. At the time, in 2005, it was reported that the employers of Wisconsin paid about 15%, on average, 15% of their payroll for healthcare benefits, for insurance benefits. We wanted to simply redirect that to a pool, to a purchasing pool that protected and provided for everybody. And at the time, there were nearly 500,000 people that didn't have insurance. So this was redirecting and supported by an employee payroll tax. Obviously, that doesn't sit well with Republicans, but you got to find the money someplace, and they're paying it anyway. We were simply trying to accomplish three things: to get a fair assessment approach, and then to cover all those citizens under 65 that weren't covered, and then to have some kind of annual review so that people could change their opinions. Not unlike the Medicare, and you're going to hear from David Riemer, I think, today too, about his young Medicare proposal, some of which is kind of Wisconsin Health Plan 2.0 in my
Right. Okay.
So
well, I mean, it does sound purple in the sense, and true to some Republican principles, to the extent that the payroll tax is meant to match what they were already paying, so it wasn't intended to be an additional tax.
But it didn't meet all the Republican principles, which were they don't like any of the Democratic principles. So, I'm unfortunately one of those Republicans who believes and came to politics because I believe compromise is the art, or politics is the art of compromise in order to do things that are good for people. We don't have that anymore. We didn't have it 15 years ago, and it hasn't changed.
Well, I'm hoping we can somehow get back to that, but I'm a dreamer, and that's what this was all about.
Yeah, and I'm chapter 20, so I'm quite proud of it. So I want everybody to buy it. And read it.
Thanks for the plug. Are you there?
Okay, here we go. I can hear you now, I think.
Oh, okay. That's good. Now we just need John.
I'm here.
Oh, good. John, okay. Yeah, I was hoping you could comment a little bit about, from your perspective, the journey to create the Wisconsin Health Plan that wasn't already covered, and what would you do differently in hindsight, and what should we do now?
Yeah, great question. When we were working on the Wisconsin Health Plan, at least from the Democratic side, our goals were to reduce costs for everybody, to cover everybody, and to improve healthcare quality. And one of the things that drove me to the healthcare discussion was covering everybody, because we did have a number of people that were uninsured, but I had a number of small businesses coming to me from my district who were extremely frustrated with double-digit annual increases in their insurance premiums, and that was just killing them. And now that I'm self-employed as a partner in a small law firm, boy, I see that myself every year, and it's just the healthcare crisis is something that is killing small businesses. It's an enormous cost that we have not been able to control. So that is something that continues to be a problem to this day. On the Democratic side, we had a number of people who were frustrated that the plan didn't go far enough. People were really seeking a Medicare for all type solution. That was a big push. Notably, one of our most important allies in the fight for the Wisconsin Health Plan was the head of the AFL-CIO, a guy named David Newby, a terrific guy. And he compromised on his thought about Medicare for all and joined us, to join the effort to pass the Wisconsin Health Plan because he thought it had the best chance of going someplace. And so at that time, and so that was an important concession from our side. Kurt, for his part, was bold and showed real leadership, but I didn't see anybody from the Republican side make the size of concession that the AFL-CIO made on our side. And so whenever you're making political change at this magnitude, you need to have people, not only individual policymakers, but people who represent important parts of your respective coalitions, be willing to come together to make change. And that is something that is vitally important. So when you're making policy in the legislature or in Congress, you in the individual lawmaker are the tip of an iceberg with a number of other people that are working with you. And unfortunately, on both the Democratic side and the Republican side, we didn't have enough people willing to come together to compromise to move this idea forward. And so that was very frustrating. And unfortunately, Kurt was. The Republicans were in control of the assembly at the time that we were working on this. His leadership team did not back Kurt at all and really undercut him. And that was a real problem. They appointed Kurt to kind of hammer out the Medicaid funding crisis that we had in Wisconsin. But when he came up with this bold solution, they were not there for him. And so that was a real problem. And so from the Democratic side, we were in the minority. We had a number of our people that didn't want to walk the plank for a symbolic vote to support the Wisconsin Health Plan that we developed because they didn't see any benefit for them politically. And so, you
Right.
referenced the payroll tax that was going to pay for this, and there are a number of people on our side that thought if this had a chance of becoming law, then they would maybe do that. But if it was just a symbolic vote, they weren't willing to take that symbolic vote, and that was a real problem. And so I guess my conclusion out of all this is that there are enough people of goodwill willing to work together to make real concessions, to make change. But whenever you do that, you have to have a group of people, policymakers and people in public life in a variety of ways, willing to come together to take a risk to move this idea forward. And unless you have people who are willing to kind of step out and take that risk, you're not going to move forward very far.
Right. So if I ask you about what should we do going forward and what's the prognosis, I guess I'm not feeling very optimistic because I'm not sure people are more willing to do that now than they were then.
Yeah, I think, if anything, we've become, as a country and as a state, more polarized since then. I hope that we can change that, but I think we have to be realistic and say where we are now is in a worse place in terms of polarization than we were 15 years ago.
Right. Yeah, I guess, well, first off, I'll ask if there's any questions from the audience because I don't want to dominate if there are others. Put them in the Q&A or the chat. I guess part of what I'm wondering, I'm waiting for other questions, but it doesn't seem that what you and Kurt and David were talking about is so different from a lot of what we're talking about with the earlier speakers. I mean, you're not opposed to transparency and competition. You're talking about some universal care, some savings account that can be used to pay for it. So that feels like competition. You're paying your own, what feels like your own money. We have a speaker right after you, by the way, that's going to talk about the concept from Milton Friedman that it should feel like you're spending your own money, even if that money was given to you by your employer or your government, if it's in a savings account and you're shopping. So are we so different, the Republicans and the Democrats? Is it just political posturing? I mean, it doesn't seem to me that we're so far apart.
My view about that is that I think that there's a difficulty conceptually as people think about competition and prices to understand that for the overwhelming majority of people, whether it's in a young Medicare / Healthy Wisconsin / Wisconsin Health Plan setting or under Medicare, that when people make choices related to medical care, the only choice that for virtually everybody is something that they can grasp onto and make sense of is the choice of a healthcare plan, the price per month to them and their family for a plan.
Right.
And I think that partly because of the state employee health plan that so many people on the Democratic side, on the left in Wisconsin are familiar with, there was a willing in Wisconsin to accept a market choice, competition, price sensitivity, provided it was linked to a comprehensive plan that if you paid more or less, it was more or less for the whole coverage, not the particular operation or the procedure, which whole nother discussion. But I don't think competition on those kinds of prices is effective. I just don't think it works in the real world. It may work in some sort of theory, but in the real world, it's far too much for people to grasp. So I do agree with John that I think the Democrats had given up a lot in being willing to embrace a market model, competition, price sensitivity. What is hard for lots of people to get is that competition based on the overall plan is where the competition should be focused, where the cost consciousness should be. And the other problem, and this is tough for both Democrats and Republicans and independents, healthcare costs money, whether it's 18% of GDP or 2.5% or anything in between. It's a hell of a lot of money, and money's got to come from somewhere.
Right.
And my belief is that if you have a rational system, even one that produces an overall lower cost, certain people that are free riding are going to have to, pay up in order to allow people who are the entities that are being ridden on for free, government and larger employers, to pay their fair share. A fair distribution of the cost of healthcare is not the distribution of who pays for it now. To get to a fair system, there are going to be some quote unquote losers and some winners. We need to recognize that and then design a financing glide path that doesn't crush those who have to pay more, and recognizes that even for those who are paying more than they should, paying less to some extent, not the full lesser amount they should pay, but less, even that would be a gain for them. Right. So that's what we were trying to get at with the idea of a payroll tax replacing employer-sponsored costs.
Sure.
Not adding on to it, but replacing it, in fact, in aggregate costing less. But unless you can get agreement on that underlying concept, it is awfully hard, and the debate very quickly defaults to ideology and name calling and misleading assertions, as John Richards was saying.
Well,
I think another important element here is people are looking for something that has a real chance of becoming law. And it was really interesting to see what happened on the federal side with the debate of the Affordable Care Act, another hugely complex, imperfect vessel for major healthcare reform. But where there was a real chance of something becoming law, people took risks. They risked their career and actually were voted out of office for passing that law, but they were willing to take that risk if something was real and tangible. And I think there is, at least I can say that from the Democratic side. On the Republican side, I think what you saw out of that episode were people hardening their positions, just reflexively opposed to any sort of reform at all through the passage of the ACA. So you had something that was essentially Romney care out of Massachusetts that Republican Governor Mitt Romney passed, that was seen in many Republican circles, including the Heritage Foundation, as something as a reasonable way to approach healthcare reform, suddenly became anathema to anybody in the conservative movement when it was taken up as an act of Congress. And so that is something that, you know, it's part of the dynamics of our time. And I hope that we can change that. I think one of the things that was really helpful with our episode was having people of goodwill, like Kurt. There were other Republicans that were involved with us to a degree. And David, we all were able to work together in a spirit of trust. We were genuinely concerned about pushing the ball forward. And I think I believe that that spirit can be revived in Wisconsin and in the country, but it takes people of intelligence and goodwill to move that forward.
I hope so. Well, thanks, Representative Richards and David. And I think we're going to hear from you again a little bit later, David, talking about the Affordable Care Act and the Democrat platform. And Representative Richards, if you're around and you're willing to weigh in as well, I'd love to hear your thoughts on that as well.